June.
After battling the deadly virus, some COVID-19 patients have reported lingering health issues. WRTV is following up with a young survivor we highlighted during our WRTV news special, Inside the COVID Crisis. He is still dealing with challenges months after the virus. Our Stephanie Wade shares his story tonight.
I didn't know what was going to happen. In my mind, if I were to fall asleep, I wasn't going to wake back up.
Back in April, 30-year-old CJ Fields just thought he had a sinus infection.
The whole process, I never thought I had it. Did you know my age? I never had underlying health issues, nothing.
Then came the high fever and shortness of breath to the point he needed to go to the hospital.
Because I basically was just gasping for air at that point.
It turned out to be the coronavirus. He was put on a ventilator for 18 days and an ECMO machine because his lungs weren't recovering.
To me, that's scary, knowing that virus just did that to me when I had no issues prior.
After spending about a month in the hospital, he recovered from COVID-19. But in the days to follow, it was a struggle.
I remember waking up and they actually came to help me use the restroom. I couldn't even walk. You know, I'm 30 years old.
Fields had to regain strength in his legs.
That was my main goal when I came home, was to walk further than what I walked the day before.
And now, as a side effect from the virus, according to his doctor, he's been diagnosed with tachycardia.
Where my heart rate stays over 100. That's just sitting down, my heart will just go up to like 130. I'm not even doing nothing. I've also have high blood pressure now due to having COVID.
Other COVID-19 patients have reported similar lingering health issues like difficulty sleeping, breathing, fatigue, body pain, and cognitive problems months after recovery.
My mind is like, why me? Like, why my age? And just why all of a sudden this thing attacks me the way it did when even older people, even with issues, don't have it as bad. You know, I don't know, it just floors my mind because it's like, what happens if I get it again? Am I going to go down the same road? I mean, they can't, no one can answer that right now.
Seemingly healthy young people having lasting effects. This is Fields' warning to you.
People thinking that the mask is all government issue, and I don't really feel like it is. I just think it's their best way of trying to help us where they can understand this virus, because they can't even give me an answer of why it hit me the way it did or why someone else. And it's just, I don't know. I just wish people would take their precautions and know that this is real.
Stephanie Wade, WRTV.